The aim of this course is pretty clear and specific. It's to help you to relate to stroke patients in a positive way, to be able to communicate your understanding of, and of most importance, to be an encouragement to them. I'd like just to mention briefly some significant aspects of my life. I was born in 1926, and you don't have to be a mathematician to work out how old I am now. And I grew up in a town in Victoria called Mildura to very elderly parents, and I'm an only child. I left school at the age of 10, having hated school. I got a job eventually as a bank clerk. And then along came the war, so I joined the RAAF and aircrew, and finally finished up in the army, because at that stage they decided that they didn't want any more aircrew, so we went off and joined the army. And because of that, the government paid for me to go back to school. And it was quite interesting to go and sit with kids at school to do matriculation in order to get into university. And so I did go to the University of Melbourne. And I was ultimately ordained as a minister of the Presbyterian Church in 1956. So that's 60 years, almost 60 years ago. And I've served in a number of parishes in Victoria and South Australia and Western Australia. And for a period of 14 years, I was the principal of a university college at UWA. I think that cost me a great deal of my life in the sense of being under stress most of the time with 18-year-olds. However, that's a different story. But also I had 19 years as a member of the Parole Board of Western Australia, making decisions as to who could be let out of prison and who should be kept in prison. And that was a very interesting thing to do. I have been married to the same person for 60 years.
Well done.
And I've been very happy over the last perhaps 15 years to be a heart support volunteer. I might have an opportunity later on to mention about heart attacks and so on, but I had 3 heart attacks in 1981, leading on to bypass surgery in 1994, and later on 2 pacemakers, including a defibrillator. Now, I don't want to say much more about that. That was a very significant moment in my life. It changed my lifestyle. I stopped smoking. I stopped worrying as much as I usually do, although I haven't really stopped. All those sort of changes that came about because of that one experience. Now, you may want to know other things about me, but that's just a sort of a little picture of who I am. But now it's your turn. I'd like to hear you tell others with whom you're going to be working a bit about your life and why you come to this point. Who'd like to kick it off?
I always think that I'm a very, very healthy person, and I've been dancing and eating well. So when it happened to me, I actually was very, very shocked because I didn't expect it. And I went to bed normal, and then I got up. Suddenly, I ended up in hospital, and that was a bit difficult for me to take and to accept. But then suddenly I told myself, well, I'm alive. I'm just so grateful that I'm still here, and I want to make it better.
We were on holiday in Bali, and my husband, it was our birthdays. Our birthdays were on the same day, funnily enough. So it was our birthday day, and I had a shower and just collapsed on the bed. And my husband had to call an ambulance and everything. I was taken to the hospital there, and I was there for 4 weeks. They operated on the brain and removed the aneurysm, put a shunt in, and then I was flown, cut a long story short, flown back to Perth. I went to Charlie's first, about 6 weeks I think, I remember, still in a coma, and eventually I was transferred to Osborne Park, and it was here that I had my rehabilitation, which was amazing.
Well, I had my stroke on the 5th of July. It's a fresh one. It's 9 months. 9 months ago. It happened during my sleep. I wanted to get up to go to the loo at around 4 o'clock or 5 o'clock, and I just realized I couldn't get out of bed. What's wrong with me? Then I just crawl on the floor, and finally I say, there's something wrong. I spent 30 hours on the floor without being able to reach a phone. There was because my partner was working in China, like our friends were all away traveling, and he was calling all day. I just hear the phone ringing. I say I couldn't do anything. I know it's in, and it went all day on Monday. And my partner just phoned some friends, said, "You have the key of the house. Just go and check if there's something's wrong." And they arrived like 30 hours later. I was on the floor, completely dehydrated. I slept literally on the floor, covering myself with a carpet in the dining room. And finally they found me after 30 hours, so they brought me at Charlie's.
In very simple terms, the most important thing that you've got to offer is the fact that you have survived, and that the patient who you're talking to may or may not think that they're going to survive. In other words, I think it's a very simple proposition that there you are, you've had all of these experiences, but you're still alive. And that itself is, one of the things that I play, it's a bit of a trick in some ways. I often ask people at the Mount or Hollywood Hospital, how old are you? And when they say, 60 or 75, I say, oh, heck, I'm 20 years older than you are. And that, in the sense, is that, well, maybe I can last longer. Maybe I can go on. So it's handy to have that. The comment I want to make now is that when the time comes to visit a patient, I believe the first contact is extremely important. Now, I don't know whether they're going to be told that a volunteer might call. Perhaps they could be confused as to who you are and why you're there. Why did you come to see me?
I would be if somebody came to visit me.
Sorry?
I would be if somebody came to visit me that I didn't know.
You didn't know who they were?
Yeah.
We will probably introduce the idea to the patients prior to you guys coming.
Yeah.
That's what we would do. Yeah.
And quite possibly it won't be for every patient that would need a visitor. So it would be for a select few. Yeah. And also we would be trying to match maybe, some similar experiences with the volunteer and the patient as well. Yeah.
He said, sometimes you get caught. I remember in a country town, the doctor said to me, I'd like you to go and visit Mrs. X because I'm a bit worried about her. And foolishly, without making much more inquiries, I went to see Mrs. X, and as I walked in the room, she said, I'm not as sick as all that, am I? Which wasn't a good start. Wasn't a good start.
Sorry, can I just ask? So it is an ongoing thing. So you go and see, say, one inpatient, and then you keep going back to the same person. To establish sort of like some friendship, some a bit of a relationship.
It might be, or it might just be that they just need one visit.
Or just one visit.
Yep, or they might want a couple of visits. And it really, how often you're available really depends on how you're feeling and how much time you have to give as well. Yeah.
Yeah.
So it's like a fluid thing. We won't be giving a set date and set visits.
Okay.
It will be just ongoing. So we'll be talking to the patients and finding out how they find your visits.
Yes.
If they want more, or they want more often or less often, it's up to you and them simply to schedule.
It's patients that are already at home or in the hospital?
Here
in the hospital. Yes.
Yeah, inpatients.
And because length of stay is shortening, it would not be that you know, just
Won't be
one
that long.
person
Yes.
ongoing because people sometimes are not here for that long.
Yes.
So all different, very varied.
Yeah.
I think
Yeah.
the first visit is very, very important. You have to make them feel
Comfortable with
very
you.
comfortable, and then we have to be very, very pleasant, friendly, and be supportive. And they know that we are there for a reason, just to be a friend, to talk over things, to tell them, you know, what to expect. Yes.
And to listen to them, yeah.
Yes.
What I'd like to do with you now is a little bit of an exercise. I want you to, if you can, imagine that I'm a patient and I'm not got a bed, I'm sitting in a chair, but I'm a patient, I'm a stroke patient, and you've come to visit me. As a volunteer, what information about the patient do you think you need to know before you go? In other words, are you going to be said, Mrs. So-and-so can't see out of one eye, or she's hard to speak, or it's a hearing, or whatever it might be? If you've got that information, it may help, it may not, I don't know. But I want you to imagine, here am I, you haven't been told anything about me except that I've had a stroke, okay? What's your approach going to be? Have a go at just how you'd actually, they don't know who you are, how would you approach me? What would be your opening gambit?
Well, the thing is, if we had some knowledge of the background of the patient, like basically when you have a stroke, you just feel incapacitated. So that all the frustration that comes to your mind, I cannot do that anymore. Like me playing the piano, the most frustrating thought. I say, I've been playing for 50 years. I have to start all over again. I lost everything. See. So when we set our goals with the therapist, we say, what you're going to say, play piano again, type again, and this, and you have to find the motivation that bring life to the patient. So if a guy is working, building furniture or something, we have to focus on how will your hand will be re-educated, rehabilitated, and so on. You just have to attract their attention to something valuable to them as a goal. It depends if it's an early stroke or after several months, or so.
I would open the conversation asking them how they're feeling today and how they've felt the treatment has been, and particularly what particular treatment helps them in any way, and how they would see how they're looking at what's going on in their life with their families and the support they're getting, and if they're not saying they're not getting any support, then maybe I wouldn't pursue that because I wouldn't want to upset them. So I'd listen, but change the conversation to the nurses that are there, and I think that they may want to talk about them, because quite honestly, your family get fed up with it. You know, I don't think my family were brilliant, but they may want to talk to somebody other than their family and other than the nurses. I ran a clinic in England for my working life, so yeah, so I'm quite used to talking to people and starting a conversation, hopefully not intruding on their lives, but maybe giving them an opening to say what they want rather than what I think they need.
Yeah. I think I might just make a comment. Well, let's hear what you have to say first. Yes.
I think emotional well-being is very, very important. So I'll introduce myself, and I'll be as very, very cheerful. I say, look at me now, I'm alive, I was a stroke patient, but look at me now, you can be. I just want that person to feel that there is something, better
than the situation that he or she is in at the moment. Just by looking at me, and I feel good, and I want to get that good feeling across to that person. For me, I feel that that is very, very important, and that there are better days ahead. You may be where you are now, but it's going to get better. All we have to do is we have good doctors, we have good physiotherapy, and then we have good medicine. If we just follow all these rules, and then we'll get better. And then the important thing is you have to help yourself. You have to believe in yourself
and
that
you've
you
got
are
to work
going,
hard.
that you are going to be well, and then and you take it from
nobody
there.
else can do it.
Yes, you
Yeah.
yourself have to do
That's
it.
right, and I think probably we found that we all worked
Yes,
really hard.
and of course you've got all the support
independently.
around you, but I think the important thing is how you think, what you want to be. You want to get better, and that's how I feel. You want to get better. How do I get better? So I will tell the person what I did, all my goals, my immediate sort of like what the things that I do, the things that I look forward to, the people that I love, and then they have got the same thing, the things that I have.
I think in some ways we're walking on a bit of dangerous ground. I think that most of you have actually gone past the initial approach to people, because what I was thinking of is it's very important as to how you present yourself and how the person understands who you are and why you're there. At that point, I wasn't expecting you to go on with an involved discussion or anything with the people. It was really a question of how do you actually, if there's any ice there or anything that might be a barrier, how do you break that so that you start to relate to the person? Let me just make a comment here that my approach is very, very simple. I actually, and I showed this I think to some of you before, we always carry it's a bit knocked around, carry a thing around our neck, you see. So,
Is it?
sorry?
Your name tag on.
Yeah, name tag. It says on the back on here is that Heart Support Australia. It's got my name and so on. And I simply walk in and I simply say, my name's Dave Robinson. I'm from Heart Support. And my only qualification is I've been there and done that. And it's as simple as that. And the person almost always responds positively. They start saying, oh, interesting, what happened to you? And I say, well, hang on a minute. At the moment, I'm really interested in what's happened to you. What are they doing to you? Why are you here? And then they usually go on and they talk about whether they're waiting for a stent to be put in, or they're waiting for a valve to be repaired, or they're waiting for more inquiries to be made or tests to be done or so on. And in a sense, it's almost like don't say too much at the beginning. Give the person the opportunity of saying as much as they want to say to you.
That's if they can speak.
If they can speak. Now, that's another issue. What do you do about a person who is unable to speak? And that's an area of which I have no competency whatsoever.
And it would be for people who are verbal and able to speak.
Yes, you would select the people who could communicate, wouldn't you? Yes, you have to do that. But it's also important, and this will come to this later on as the content of the conversation you might have, is that don't overload them with facts about yourself. Later on, you may, in fact, as an encouragement, be able to say, yes, I've had a similar experience to that. Or something like that, or whatever it is, but it's picking up what they're saying, not loading onto them anything that you want to say initially. Later on, it may be quite possible, and I do this, and I do say to people, look, I can understand a lot how you feel, because I can recall having 4 bypasses and spending 2 weeks in Charlie Gully Gardens Hospital and so on. But that comes later. The initial...
We let them do the talking first.
The better if they're prepared to talk and tell you,
Yes.
you're halfway there. And whatever you do, don't make promises. I'll come to this later on. Don't make promises about what might be their outcome as compared to your outcome. Because people are so unique and so different. And if in fact you say to them something like, I'm sure you'll be all right, I cringe when I hear that phrase on the movies or anywhere else. How do you know they're going to be all right, right?
People saying to me, you'll be fine.
Yeah.
It's such a blasé.
It's more for their benefit than for yours. It makes them feel better if they can say.
You can't move.
So if you can grab hold of that and say that the initial approach is to identify yourself, and I hope that they might be able to wear something like that, which has got a degree of authority about it too, right? You're just not a stranger that's wandered in and wants to sell them something. I think the first question is, how are you feeling? Or however you do it, it might be what stage have you got to in your rehab, or even how long have you been in hospital, or something like that, or how were you affected by the stroke that you've had? Because you know that they're all there because of a stroke of some sort, right? You occasionally get caught when you go into the wrong room and they tell you, no, I'm here because I've got a kidney problem, and you realise you've been misled by the staff. That's happened. But no, that's I think that initial approach is very important. I've only ever once in 14 years been told to bugger off. And the reason Black said that to me was because he thought I was representing Heart Foundation, which collects money. Right? Even when I tried to explain, no, go away. And that's the only time it's ever happened. That everyone that's had a stroke has got probably a different story.
Well, there's so many intensities of stroke.
Yeah.
And different types of strokes. So.
Yes.
And I guess it's about those open-ended questions. So asking people open-ended questions that they can't just give a yes or no response to.
Right.
Yeah. So be mindful when you're, when you're thinking about what to ask them.
I've got something about that later on.
Yeah.
What's open-ended and what's not. The closed questions can put people into a very difficult situation. I don't really know how to respond to that. We'll come to that later on.
I would avoid questioning directly people on how they feel, because they will say,
That's right.
I don't like to be asked how I feel about, especially this situation. You don't know what you feel. You feel everything. You don't feel like expressing it.
But there are good days, there are bad days. But for me, lying in hospital, whenever someone came in, I would straight away sort of pay very, very good attention. And straight away I wonder, who was that person? Why is he here or why is she here? And straight away I wanted to know the name and then see how that person is, the approach to me. And if that person gives me a very, very nice, warm smile, I feel very, very comfortable. And that is me, I like to know who the person is, and that person sort of like smiling, friendly, nice to me. Then I feel comfortable. And then, I tend to open up. And if they ask me questions.
How about, instead of saying how you feel, what about a general question like, how's your day been today so far? One of those.
That's open-ended. And also it depends upon what's happened, because I know, again, it's a translation on my part. It doesn't make perhaps appropriate, but I've had people say to me that I'm going to have a pacemaker put in today. And I've said to them, well, how do you feel about having a pacemaker put in? And they say, well, I'm very anxious about it. And then I can go on and say, well, look, I've had this now since 2004, and it's great. It's a safety device, so it gives you an opening. but depends upon what the subject is in some ways, right? So just a general feeling, they might say anything. I mean, that's not the question I would ask. In a general sense, it would have to be something specific, right? I mean, the person might say, I think I'm going to be discharged in 3 days' time. I think a question could be, well, are you happy about that? Are you looking forward to it? Or whatever it might be, right? And that might lead to a whole lot of stuff coming out. But anyhow, that's another question. So you have to get that translated into what's the problem person's got that brought them in the first place. The other comment I've got written down here, the next step, having in a sense introduced yourself and made that contact, is I've usually asked the person to share their experiences with me. And once again, what you might get from a stroke patient is pretty different to what you might get from a heart patient. I mean, the average stay in hospital now for a heart patient is 5 days.
Wow.
Even after bypass surgery. And so it's really quite short. And for a valve or a pacemaker, it's even shorter than that. But to give them the opportunity of talking about their experience. And sometimes people go on and talk a bit about the background as well. I mean, in one case, I sometimes ask people, are you a local or a country person? And one guy replied, neither. And I said, what do you mean neither? He said, I come from Mongolia. He was a fly-in, fly-out worker. Yeah. And that was interesting too. But I think there are general questions just so you can if you can get the person talking a bit about their background, about some of perhaps their anxieties or their good experiences or what, then your role is basically a listener.
Yeah.
Basically a listener. Not to interject any more of yourself into it other than to be able to emphasise with the person about their condition, right? You might say, for example, I've got a problem with my left eye, right? But I think you could still understand the person who says, I've got a problem with my speech, it's a bit slurred. I mean, there's enough what's the right word, enough correspondence between these things. Having a stroke is having a stroke, and it may affect people in such different ways, but there is a commonality about it, I think, that will fit. So, oh yes, if you ask the person to share their experiences with you, that is an opening for them to actually ask questions of you. I've had questions like, how long did it take you to recover from surgery? If they put a pacemaker in, is it okay for me to go on an aeroplane? And will I lose my driving licence? Questions, many of them which I can't answer, but at least they're expressing their anxiety about the thing. And I think if you can pick up not just even the content of what people are saying, but the feelings behind the thing, and if you can relate to that, for example, if I don't know, well, you might not agree with this, but sometimes it's very important, the person who tells you or makes all these questions, to be able to say, you sound pretty anxious about it. Now, the person knows that you understand them. You're not going to argue with them about the right or the wrong of driving a motor car. Mm-hmm. You know? You're not going to argue with them and say, everybody gets a pacemaker is going to be okay, because that may not happen. But to talk about, reflect on their feeling if you're feeling anxious. Or on the other hand, if somebody says, I've really had a wonderful time with the stuff, you sound really very happy about the experience here, right? And that's again an expression of your understanding of what the person is on about. And I think that's one of the fundamental things about being a visitor, is that it's the patient is the important one, not you. And for them to be able and want to communicate to you, you're about 99% along the road. Right? Sometimes you might get some things said to you that are upsetting. What if somebody says to you, I can't stand the staff around here, they're a mob of idiots. What's the response to that?
I don't like the food.
Well, will the patient be introduced to the idea that, listen, would you be interested in having somebody visit you, and just prepare them? You say, yes, I'd love to. No way.
Yeah, we'll do that prior to your
Yeah, it's good.
And it won't be everyone that wants to.
Say that again. I missed a bit of that. Sorry.
Well, we should ask, the patient should be asked if they want a visitor like us.
Oh, of course. Yes, of course. Yes.
So that's a solve part of
You're
the
a long
problem.
time in hospital. It's a long day.
Yeah.
I remember, you're awake 6 in the morning, and it's a long day.
Nobody was lucky as me and my partner spend 12 hours a day here.
There's another way of thinking about what you might be doing as a visitor, and that is reflect for a minute on not only on the people who have been a great encouragement to you, but think of the people who've in a sense got up your nose. People who might have said strange and funny things to you which didn't really be much good at all to you, and think of that as being maybe to be very, very careful what you might say to a patient.